In December 2020, our hospitals were absolutely full.
There wasn't enough testing, PPE challenges, vaccine challenges.
It was clear that we had to understand how we were going to help one another.
So the community came together in ways in which we've never done before.
We were able to share resources, help one another with vaccinations.
We saw our community partners come drop off gowns and masks.
We were able to share best practices, align visitation policies, share PPE, share vaccines, share testing equipment.
It was absolutely amazing the way the community came together to really support the needs of one another.
Caring for this region is a team sport.
The amazing thing is that the collaboration that we demonstrated during COVID amongst all of the institutions, both in Syracuse and regionally, that will carry forward.
It's so critically important for all of us to look at how we can work together to better meet the emerging needs in our regions.
I think it's really created an opportunity now for us to provide care differently to the community.
Coming out of the pandemic, we saw that people are increasingly sick and likewise have higher levels of mental health needs. And so it was those two factors that really drove our initiatives to expand our restorative care unit, our subacute unit, to help people move from the hospital to a lower acuity level of care quicker, and also drove our desire to create a specialized advanced dementia and behavioral unit to address those behavioral health needs.
I think drones are a part of our future. We can transport certain things that may have a sense of urgency, like blood products or a biopsy that has to come to an expert here. We're expanding our experimental drone program now to what we call an autonomous machines program. And we have robots now that are doing jobs that traditionally many of our nurses had to do. This frees them up at the bedside, which is exciting. But I see that as a natural progression forward in the area of logistics and supply chain management and freeing up people to take care of people.
We're excited about our population health initiatives, which are designed to improve quality and lower costs for our patients and enhance the patient experience. Population health is something we had that infrastructure prior to COVID, and COVID accentuated the need because there were access issues during COVID. So we were able to jumpstart telemedicine, and a lot of our care management really was enhanced during COVID. And as we come out of COVID, those are lessons that we take, and those are care management infrastructure that we take on our population health initiatives. So that's exciting to be able to take some of the work that was focused on COVID and really improve the health of the population going forward.
Some of the things that we continually are focusing on is patient progression. So how can we progress patients through the system in a more seamless way, whether it's through the emergency room or their care within the hospital environment. We're continually looking at ways to expand, but expanding doesn't necessarily mean it's within the four walls of the hospital. So I think that's really exciting, not only for us, but for the community in terms of services that we'll be able to offer to them.
We're very hopeful and excited for the future.
We've been through a very difficult time, but I'm bullish for the future.
That sense of resiliency and teamwork and commitment now has spilled over into the present, and I think will serve us for the future.
We're partnering with providers and agencies in ways that we hadn't before, and I think it just shows that we're all in this together. You can't exist as a single standalone entity, but really need to rely on your community partners, your providers, others in the area, one another, to really be able to thrive.
On behalf of Crouse Health,
SUNY Upstate Medical University,
On behalf of Loretto,
St. Joseph's Health,
welcome to Syracuse.